Hi, Pharmacist Brad White for the Medicine Center Pharmacy. I want to talk to you today about the two most common forms of testosterone replacement therapy. We're going to talk about injectable testosterone and compounded topical testosterone. You know, we struggle as we get older, men in particular, with lower testosterone levels, and that's called andropause. Let's face it, with aging comes many changes. You may feel more tired, less motivated, you may gain some weight around the middle, you might notice a drop in your sex drive. All these things could be signs that your testosterone levels are on the decline. But the good news is we've got options for you, and I want to talk to you about the two most common forms of testosterone therapy: injectable testosterone and compounded topical testosterone. So with injectable testosterone, it's most commonly used testosterone cypionate or enanthate. There's some pros. You know, you get really reliable absorption. It's injected right into the muscle, so that absorption is highly predictable, and it gets into your body, and you get a consistent dose. You don't have to dose it as often. Many men get doses once a week, maybe twice a week. You get higher peak levels in the beginning. Sometimes you get that get up and go energy boost right after the injection, and you might feel that dose is more noticeable for you. But there are some injection cons. You know, you got to use a needle. How many people want to get an injection? And sometimes when you give that shot, you got to have someone help you and give it in the glute or in the thigh. You can also get hormone spikes because in the beginning you get that big burst of dose that goes in the muscle, and you know, you might feel like really good for the first couple days, but then as that dose wears off, you might feel sluggish or feel like you've got a gap in your therapy. And sometimes you can have injection site reactions too. With topical compounded testosterone, usually it's a cream or gel. You can get your dose customized to your blood levels and your symptom profile. You apply it on a once or twice a day basis. You could look at that as a drawback, but the reality is with consistent application, you get a consistent blood level. You don't need a needle. Usually application is on your inner arm or inner thigh or sometimes on the scrotum. You do have to be concerned with that daily routine. You got to be consistent. There is a risk that you could transfer medication to another partner or person or pet. So we just make sure that you're aware that after you apply that, you don't have skin-to-skin contact for an hour or cover it with clothing. Sometimes, depending on the layer of thickness of your skin, you could get some variance in absorption, but we can help coach you through that too. Regular hormone checks are the key, and so that's how we can help you monitor it. So which one's better? It kind of depends on you. I have my own biases because I like customization and predictability, but if you're someone who doesn't mind a shot and you want to set it and forget it, once you can get the dose dialed in, the injections may be for you. But if you want a more consistent approach that you can customize, very easy, you don't need a needle, you're going to want to talk to us about a custom topical compounded solution. So as a compounding pharmacist, I work closely with you and your provider to help you monitor your labs and adjust your dose as needed. You don't have a cookie cutter option here, it's custom all the way, custom for you. So whether you choose injectable or topical, the most important thing is that you feel like yourself again, energetic, focused, strong, confident. The testosterone therapy isn't about turning back the clock. It's about giving you the quality of life you deserve as you age gracefully and powerfully. So if you have questions or you want to explore what's right for you, please reach out to us here at the Medicine Center Pharmacy. We are here to personalize your care in every step of the way at the Medicine Center Pharmacy in New Philadelphia, Ohio. If you got questions, you can drop them below in the comments or stop by the pharmacy and we'd be happy to be a resource for you.